Good morning. Is that working? Is that working? Good morning, everyone. Just before we start, just to run through some practical bits again. Hang on, my notes are upside down. There we go. So for those of you who were here yesterday, you might remember that we were told that there would be a fire alarm. We've now been told it will be on Friday, so it will miss us. Which means if you hear the fire alarm, it's real. So please do proceed to the nearest fire exit. You can go directly out of these doors and then right just after the coffee machines. And that's the quickest way out down the stairs. The second thing was, again, if you weren't here yesterday, coffees and lunch. Coffee, you've already discovered, is just outside. Lunch will be served. It's a buffet at the bar. And if you are gluten-free, vegan, just say as you're going up. And for anyone who wasn't here yesterday, the lunch was really good. So hopefully it will be just as good today. Again, we are filming this morning. So if you have any issues with that, do please come and see me if you don't want to be in shot. And then two more things. If you're asking questions during Q&As, please do stand up if you can and say your name and organisation just before you ask your question, and that would be great. And finally, this is day 2 of Cash Week in London, but as you all know, it's been going on for, I guess, 2 weeks, actually, 3 weeks, possibly. And so today, simultaneously, is actually a learning event going on in Nairobi as part of Cash Week, which is delivering cash better, 3 opportunities for improved programming. So whilst we're here, they're there and have already been at the learning event for an hour or so, I believe. I think that's everything. Again, if any questions, do please come and speak to me. If you can't hear at any point, just make a motion and we'll see what we can do. Okay, and I'm going to hand over to Sophie.
Thank you very much, Rose, and welcome to day 2 of Cash Week. Great to see you all here. Thanks so much for coming to today's session. I know that while the future of financial assistance sounds exciting and visionary and cool, the session title, Operational Models, does not sound quite as exciting, but let me assure you, we are equally excited about it. It has a lot to do with the future of financial assistance, and I think as we were planning this year's Cash Week and we were looking back at the biggest developments that have happened since we met last time, since Cash Week last year, the emergence of new operational models, new collaborative ways of working, both between humanitarian actors and between humanitarian actors and those outside the sector, is one of the biggest seismic changes that we see, one of the biggest developments, which has both implications for the ways that we all work within our organisations and together, and also presents some really exciting opportunities to build differently, build on what we've learned and do better in the future. So what we want to do today is to run through some of the big developments that have happened over the last couple of years, 18 months, and over the last month in terms of the ways that we work together and new emerging models. We want to come to a collective understanding of what that means for the ways that we work and what that means in terms of opportunities to build differently and do better. And then we want to dive into 4 areas in particular and have a think about what success would look like in those areas, how we can take advantage of everything that we've learned across the network, and how we can build intentionally from the outset to make sure that we are building the strongest models that we possibly can. And interestingly, no one on my panel today self-identifies as an operational model. So it's a term that, CALP has been using. I think we'll have an interesting discussion today about how we see operational models and how other emerging models and approaches see themselves. So that's a conversation we will get into. So very quickly, the running order for today is, first of all, we have an excellent panel representing 3 sort of operational models, and you'll hear more about that later. We have Lars Peter Nissen, who is the director of ACAPS and the co-founder of the H2H network. Then we have Rosie Jackson from DFID, humanitarian advisor and cash policy lead. And then we'll turn over to Dominic Courage, who's the head of emergency cash and economic programming from Save the Children, and who represents today the collaborative cash delivery network. And then we have Claire Mariani from UNICEF, who will be representing the UN Common Cash Statement today. So we're going to hear a little bit from our panel about what emerging operational models look like, what the aims are, what the opportunities are that they're excited about, and what the key challenges are that they face. We're then going to turn to Hélène Juliard, who is going to present a major piece of research that she's done as key aid consulting with DFID, looking at the user-centered value for money in cash and voucher assistance. So we're going to hear a little bit about the drivers of value for money for users in emerging operational models. And we're then going to dive in depth into 4 areas that have emerged in our work in this area as being particularly important. We're going to look at monitoring, evaluation and learning in emerging operational models, at accountability to affected people, at the enablers of collaboration, what good collaboration looks like, and about how emerging operational models can and should work with national systems. And we're going to pass the baton to all of you for that, for some in-depth group work. So, as many of you know, we have the operational models workstream at CALP has gone on for a couple of years. Once we saw the trend towards working differently together, collaborative ways of working, we developed an operational models framework to try and track what good collaboration looked like, what the drivers of efficiency, effectiveness and accountability were in emerging operational models. And over the last several months, we've held a series of webinars to look at the state of the evidence in certain areas and what that means for emerging operational models. So today's session is going to be less about presenting a number of different models and talking through what's been achieved and what the design is, and more about looking to the future and seeing what the opportunities are to work differently and work better. So, I'm going to minimise me talking today, but very quickly. So, a quick backgrounder, and those of you who joined our webinars, apologies for the repeat here. Why do we see new operational models emerging, and what do we mean by operational models? It'll come as no surprise to any of you in the room that as the scale of cash and vouchers in humanitarian assistance increases, and we're talking a massive increase from $2 billion in 2015 to $4.7 billion last year, this, of course, implies changes to the roles of humanitarian actors and the ways that we work together. And over the past several years, we've seen a number of new ways of working together to deliver cash emerging. And we've bundled them as CALP under the heading of operational models. And when we say operational model, we mean the overall structure through which agencies work jointly to deliver cash and voucher programming in situation response and analysis, program design and implementation. And the State of the World's Cash, the first State of the World's Cash report, which was published at the beginning of last year, identifies a number of different types of operational model, including consortia and alliances, shared cash delivery mechanisms, single agency cash delivery, and the emergence and growth and the integration of systems. And I think since that report was published, we've seen some new and different examples, in particular the emergence and growth over the last 18 months of the collaborative cash delivery network, and we'll hear more about that today, and the announcement last December from UNHCR, WFP, UNICEF and OCHA that they plan to work together on a common cash system, and we'll hear more about that today. These developments, as I've mentioned, present a huge opportunity to build on the best of what we've learned as a network about how to deliver more effective, efficient and accountable cash assistance, and of course present unique challenges and opportunities around working together, which should drive system-wide learning and improvement. So I've mentioned today what we're trying to do today. We're trying to come together to understand what does the emergence of new collaborative ways of working mean for all of us in the room. What are the key opportunities that it presents, and what are the key challenges that we have to bear in mind? And then we're going to come together and think in a number of areas, what would success look like? What would it look like to build on the state of the evidence and to do better, build intentionally around a couple of key areas? And what we'll come out of today with is a sort of very rough list of what we see as objectives and success criteria in certain areas, which we hope that emerging operational models will bear in mind and consider in their development. So I promise to minimise the amount that I talk today. So without further ado, I want to introduce our panel. What we're going to do with the panel is first of all ask each of you, as you see new and different operational models emerging, can you tell us what your one big hope is, one thing that you hope we'll see over the next year, and one big risk, one thing that we need to make sure we avoid as operational models emerge? So I'm going to start with Rosie and work backwards if I can. Rosie, one hope and one fear.
Great. Thanks, Sophie. I think for us, probably, hopefully reflective, our big hope is that the change that we see is in quality, or that it feeds into quality, that where we're making cost savings and efficiencies, that this turns into improved effectiveness. So that's the big hope. And what we want to avoid is creating additional structures, additional systems, and hoping, without losing weight, she says as the pregnant lady, but without streamlining. So we don't want to add anything to the current system.
Thank you. So for the UN CCS, or UN Common Cash Statement, I mean, for us, I think the biggest hope is for us to be able to develop a collaborative approach that will allow us to really have a clear, responsive and quick approach to deliver cash, and really looking at it from a beneficiary perspective, while at the same time being able to maintain a diversity of response. I think for us is very keen to be able to do that. And our biggest fear will be to not be able to do that because of competition. So not being able to really move past this competition that is really like a huge bottleneck for organizations to come together.
Yeah, so I've looked at this slightly beyond a year, but I think the one big hope is that we develop collaborative, flexible, adaptive ways of working as the norm, and I guess the CCD, which needs to grow eventually, can become a much lighter structure, and isn't needed so much in terms of facilitating that, and to avoid, I think similarly, to avoid closing up to our own competitive interests and not exploring this enough together, and being possessive about ways of working. So I think that's one thing to avoid, so that we don't end up with different blocks of organisations and different maybe blocks of technology alignments. And I think those are things to really avoid.
I think my hope is that we find new ways of strengthening the overall accountability of our joint actions. My big fear is that we will keep on repeating the same mistakes we have been repeating for years.
Great. And then on that uplifting note, Lars Peter. So as is traditional with this, as has become traditional with this mini webinar series that we launched, we're going to start slightly outside the cash bubble, and we're going to turn first to Lars Peter, who is director of ACAPS, but also co-founder of the H2H network. And for those of you who aren't familiar with the H2H network, I won't do as good a job of explaining what it is as Lars Peter will. From where you sit then, are we on the right track with respect to collaboration in the humanitarian system?
I'd probably phrase it slightly differently. I think we will be put on the right track. I think there are some dynamics that will drive us in the right direction. And in that sense, I am quite hopeful that we will evolve and change the way we work. I'll try to give you a perspective from the past 10 years at ACAPS. We're just 10 years old now, and trying to create from that position or carving out a space for independent analysis, in a sense to try to give a bigger role for evidence in decision making. And it's been a hugely interesting process to try to grow this organization on the margins of the humanitarian sector. And it has changed my way of thinking about what it actually is we do. And I will try to quickly sketch out what some of those insights I gained from that position are. And I hope that it's not too far away from your world. I'm not a cash person as such. I don't normally come here. But I hope I managed to give you a complementary perspective that's useful in these conversations moving forward. And I think the first thing, no, let's not call it an operational model. Let's call it a business model. I think that's really useful language because it puts the focus on the incentives that we as organizations operate with. I want to say that doesn't mean that I think people affected by crisis can be compared to consumers. I think it's a very different thing. So I'm not reducing what we do to simply a question of procuring the right sort of assistance, but it helps put focus on us as organizations, our incentives, and the dysfunctionalities that are in the way we currently do business. I'd like to make explicit 4 points that sort of informs my thinking, 4 assumptions that I think are important, and then outline 3 dynamics that I see in the sector and I think will shape the way we look in maybe 5 years or maybe 10 years. Firstly, I think we all agree that the basic problem we have is we need to find a way to shift the business model from a supply-driven to a demand-driven model. And obviously, we can all see the great potential of cash in that respect. I also don't think any of us in this room are particularly happy with how we are doing on that. Right? I think if I asked you how many of you believe that we must get much better, or how many of you believe that accountability is really key to what we do, you would all raise your hand. If I asked you, are we doing well enough, how many of you would really raise your hand to that question? I don't think very many, right? And so there's something we're not getting right. And I think in order to address it, we probably need to come to terms with it. What we're dealing with here is not a complicated problem. It's a complex problem. When I heard you discussing yesterday, and when I read the report that has been published, it's a great report. And it outlines in great detail and has many insights into what all the challenges are with cash. At the same time, I think the problem we have is that it's not about building a house, it's growing a garden. It's fostering an ecosystem. And different rules apply. So if you don't coordinate an ecosystem, you don't coordinate a garden, you weed it out and you water it and you put in some new plants and you see what grows. And so if we want to be successful in this new humanitarian paradigm or this new business model, we have to find a different toolbox. And when I heard you speaking yesterday, and again, I am providing you with a complementary perspective rather than the ultimate truth here. When I heard you speaking yesterday, I was thinking, these guys are looking for complicated solutions to a complex problem. Right? So we are defining in great detail what this piece of tech can do for us and how we construct an operational model. And really, maybe what we need to look at is the incentives that drives us. And maybe the fundamental problem is that the way we incentivize drives us towards upward accountability rather than downward accountability. So that, in a sense, we are not sufficiently responsive to the needs of the people we serve. It's supply, not demand. And the way to solve that problem is not necessarily to describe it in great detail or do policy. It's around thinking about how do we actually stock that ecosystem with organizations. What kind of a system do we need to solve this problem? And I think sometimes because we are so focused on coordination in this sector, we overlook the fact that our problem is not that we are too diverse, it's that we are too much the same. Right? You coordinate when you have basically the same type of actor competing for scarce resources. So if you have a bunch of NGOs and UN agencies who all want the biggest slice of the pie in the appeal, you need to coordinate to deconflict their actions. Collaboration is a fundamentally different process. It's not about cutting the cake. It's about making the cake bigger by creating shared value between two very different organizations. And so I think we need to think about how do we grow an ecosystem that is far more diverse with new types of humanitarian organizations. And maybe the humanitarian organizations of the future haven't even been born yet. Right? Maybe in 10 years' time we'll have a whole new generation of actors that perform differently. So the point of departure for what I'm going to say now, I'm going to get a bit more concrete, is basically we should think in terms of a business model. It's a complex problem, not a complicated one. The shift we're looking at is one from coordination to collaboration. And in order to be successful in that, we need a far more diverse range of actors around the table to create shared value rather than competing for the same resources. So that's sort of the point of departure for what I'm saying. And with that in mind, I see three things that I think will happen in the next 5 years, 10 years. I don't know about the time frame. That's very hard to say. But I think we know that disruptions tend to come very quickly and overwhelm us. And by the time we actually see them, then it's too late and the change has happened. So the first one is clearly cash, there's economies of scale here. And I see the bulk of humanitarian assistance probably being distributed between 2-3 platforms. Right? And I think you have two options here, the CCD and the UN platform. I think that's probably going to be where the bulk of the resources travel through the sector. And that's probably a good thing because that's quite an effective way of doing it. So that's the first big trend. And I think that's on the horizon quite clearly. Secondly, I think we need to then grow a new set of actors that serve sort of almost as checks and balances to this mainstream humanitarian distribution between these 2-3 platforms. And I think Ground Truth is an example of that, providing a feedback loop. I think ACAPS is another example of that, providing sort of an independent, operationally independent view of what the humanitarian narrative is in a given sector. So that's a second trend, the need for independence. And again, something we're quite uncomfortable with because we talk so much about coordination. So what are you talking about, independence? Right? And for the past 10 years, trying to carve out that space for ACAPS, that has been a very real thing that we've been confronted with again and again. And it really changed the way I looked at the mainstream humanitarian sector. So that's the second thing. Economies of scale, checks and balances. And then I think we need to figure out, once you have this demand-driven, really effective, heavy-lifting machinery delivering the bulk of the assistance to 2-3 competing platforms, exactly like we saw in Turkey recently. Then what around the edges? What about the populations that are not served by this big machine? What about the places where the market can't deliver? What do we do there? What does the humanitarian agenda look like? What does a principled outcome look like in a distributed system? And that I don't think we have a very good answer to. But I can see some functions that we need to perform to make sure that we get an overall principled outcome in addition to the mainstream distribution of resources. And one is picking up the pieces, obviously the things that are not served by whatever system emerges, either because this population, the government doesn't want to serve them, or nobody wants to go there and provide financial services, whatever the reason, there needs to be a complement of sort of traditional humanitarian service delivery there. Secondly, I think mobilizing non-humanitarians to do the heavy lifting. If you could take the travel industry, right, who operates in many of the places that are hit by natural disasters. Can't we get those guys to do the heavy lifting in Mozambique after Cyclone Idai? They have the infrastructure, they have the resources. How can we mobilize non-humanitarians to be force multipliers for us, if you want? And then the final point is, how do we then advocate? There's a big role to not just reduce the humanitarian project to this very, very effective distribution of resources through cash distributions, but what about protection? How do we advocate? Those are some of the functions that need to be there as a complement to the mainstream cash distribution. So that's sort of the business model, as I see it, being shaped by the changes. Economies of scale, meaning that the bulk of resources go through 2-3 big platforms. The need for an independent checks and balances architecture with small organizations focused on that. And thirdly, reinterpreting what do the humanitarian principles look like in a network-centric way of operating. Thank you.
Brilliant. Thank you so much. So taking us now from the whole humanitarian ecosystem and the future of the ecosystem into a slightly narrower view of emerging operational models and approaches around cash and voucher assistance. And turning to Rosie, from the DFID perspective, what do you hope to see from these emerging operational models and approaches? And over the next 5 years, what are the changes we should be looking for there?
Good. Thanks, Sophie, and thanks, Lars Peter. That was a very open perspective. I wanted to try and cover 3 things in my intervention. One is really trying to frame how DFID see this emerging area. I'm then going to run through a little bit around the common donor approach and then come back to DFID really and give some reflections on progress to date. So I wanted to start with something that's, I think, well understood. DFID certainly see that change is necessary, that it's appropriate, that it's feasible, and also that it's slow. And I think what points to this discussion is that we would identify obstacles that are slowing down progress in ways of working, but also in our capacity as humanitarian actors to make the most of the opportunities that are available to us. So we don't so much focus on operational models per se. So Sophie mentioned that we're all going to object to that term. But we would look more at operational approaches. And I think with that in mind, we're not looking for one model that can deliver all. We're looking for incremental change that can be delivered. So I think to use the same analogy, where if we're looking at creating a new garden, our problem is that a garden already exists. So it's about, in terms of how we get to this new garden, what are the sort of incremental changes that are needed. So we really focus on that approach because we are understanding the contextual differences of where we're working, the need to be flexible, not only to the different contexts that we find that we're working in, but also flexible because evolution and all of the things that we can take advantage of around technology, around partnership, around different things that are happening in the private sector, but also amongst new and emerging humanitarian actors. We need to be flexible in our approach to be able to continue, in reality, to keep up, but also, to be able to make the most of those. So DFID frames its cash policy using a set of principles, and the principles are there to reflect and to help us to drive the change that we want to see within the system, looking at efficiency and effectiveness in the same way that everybody else does. But looking around efficiency, then it's about exploring new partnerships, whether that's private sector or whether that's the way that we partner with actors that we're more familiar with. Looking at new accountability systems, so we're exploring, for example, third-party monitoring, but also looking at how having common metrics amongst different partners for monitoring, looking at technology, and then really exploring this idea of comparative advantage and helping to invest in specialisms within the sector to be able to hopefully find some of that efficiency on cost savings. On the effectiveness side, DFID's cash programs are very broad. A large bulk of our humanitarian cash is multi-purpose cash grants, but also have quite a few quite a big drive around the sector ones as well. So looking at from a quality perspective, we have a broad approach. But on the policy and really trying to drive the change, we've identified 3 key areas. And I think some are more common to the conversation, like AAP and value for money, and multi-sector decision making. But also DFID has a strong focus on humanitarian cash and its links to social protection, links and use in protracted crises. And I think this is a really important one to pull out here because we're not looking at, we haven't been presented with a platform yet that can adequately bridge those 2 contexts. So within that area, related to this discussion, we're looking at how can these 2 approaches talk to each other. We don't want to create a parallel humanitarian structure. And coming right down to operational aspects around data interoperability between systems, but also more technical ones around some of the analyses. On value for money, we're going to hear a little bit more about a study that we've recently commissioned. But for the value for money, this is really trying to identify the means by which to be able to prioritise value for money at the user end. So we know that we're much better at calculating efficiencies that have been sought at the implementing side. So we're looking at how we can transfer any cost savings that are made in the way that we're working together and transfer that to the ways that add value for money at the user end. I think I'll leave that there. So on the common donor approach, so this is a donor collaboration that is driven really in the acknowledgement of donors that we need to also play our part in setting expectations for the growth of cash, setting expectations and guidance for partners in terms of how donors foresee this investment in scaling up to meet the challenges around cash. But also acknowledging that greater alignment between donors will be useful for ourselves, but also critically for partners at country level and at global level. But I think so the common donor approach is a document in its own right. I'm sure you're all very familiar with it. And that came out of the cash group underneath the Good Humanitarian Donorship. So that was middle of last year. And much of the work that was happening around large-scale cash programs in and around the Syria response. But we had done a deep dive. So this joint donor statement that is now guiding some of the more intensive work that donors are doing together really came out of, it's really founded on a common desire of those donors to drive and accelerate the change that we know is possible. So it represents a deep dive. It's intentionally selective, but doesn't mean they're the only areas where we think it's really important to focus on. But it has 9 overall areas, priority areas to tackle, they're called. 4 on efficiency and 5 on effectiveness. And we are going to be piloting through 2 countries, Nigeria and Bangladesh. And this is a piloting as much of donor collaboration and our systems for aligning as it is working with partners. So, conscious of time, pull it over. Reflections then, again, coming back to DFID, so this really, I can't speak for all donors on this. I think in terms of the progress to date, so not just on looking at the sort of obvious ones, but I think there's lots of different examples of how people are trying to, how organisations are trying to adapt to this. There's lots of positive, meaningful collaboration, which has led to improved systems, shared approaches, and shared policy. There has been a lot of progress on implementation platforms, and for us and other partners, I know this is not just about cash, so about data interoperability, around shared data policies, and knowledge sharing. And it's also been really useful in highlighting some sort of new issues like digital identity and data protection. I think there's been some really good progress on that. In terms of what do we want to see in the next 5 years, I think there's been a lot of talk, there's been less walk, including from the donors' perspective. We're at that stage now. Everybody's is collaborating, coming together. So I think a bit early to judge it. So maybe hopes and expectations moving forward. It's been already said by a few of the panelists, but just to make sure that the benefits are weighted towards, at the moment, benefits are weighted towards us, implementing agencies. It is about what's our business model going to look like moving forward? How can we all participate in the future of cash? And so really just something to look out for. We're hoping that the balance shifts over. They are at the moment somewhat exclusive, even if intending to be inclusive eventually. There's a lot of inward-focused discussions, a lot of, I don't want to say navel gazing, it's very negative, but just to make sure that they are inclusive, that they do talk to each other, but also that they talk to some of the specialised entities that are coming in, ACAPs, Ground Truths, etc. Lots of different specialist organisations that are coming up, offering really valuable, important services. And for us, I think there are technical areas that we're not talking about yet. They're kind of loosely referred to in lots of the documents, but around accountability is kind of, and will be more accountable. Multi-sector planning is something that really hasn't been talked about. It's been referred to a lot, but around how we're going to improve that. And certainly the links to long-term, we're really not hearing those sorts of discussions happening. So I'll leave it there.
Thank you so much, Rosie. Lots and lots to be thinking about for the rest of today. Thank you. So turning now to Dominic Courage, who is Head of Emergency Cash at Save the Children, but comes today wearing his Collaborative Cash Delivery Network hat. Bearing in mind Lars Peter and Rosie's words about hopes for the future, what's the vision for the CCD? And noting that we'll hear a lot from the CCD over the course of the week. They helped to present the social protection session yesterday. There'll be a demonstration of their response builder model this afternoon. What was the CCD created to do and to change? And what do you see as the key opportunities and challenges as you grow the model?
Thank you. I guess, I mean, the vision is about affected people being served by a system overall that is effective, responsive to context, and in appropriate ways harmonised. So that doesn't mean one system, I think, as a number of us have outlined, or even doesn't necessarily mean a CCD system, but that conventions, methods of working together are commonly established and flexibly used. And that's what the CCD really exists to do. And that's the kind of thing that exists in most healthy industries. So if we go away from the garden analogy to a construction one, which is my original background, in construction you have standard dimensions of bricks, tiles, standard specifications. You have standard forms of contracts, templates for doing routine tasks. You have some software to link up logistics. And all of those things allows some organizations to collaborate that are very different, and to do it in incredibly inventive and creative ways that you see, maybe out the window. And so I guess the vision for us is that cash evolves to look a bit more like a modern industry, similar to our collaborators, whether that's financial service providers, the travel industry that Lars mentioned. I guess, how do you do that from where we start? And for us, that's about doing the difficult work of finding a better way of working, of getting together around that. And for us, really, it starts around getting a collaboration manager out to the field so that everything we do is rooted in that experience. And we're doing that in Uganda, Colombia, Ecuador, Ethiopia. And then to equip that person with tools and standards to make them effective in that role. And eventually, we can draw on technology to try and eliminate some of the friction in that process. But it's really a process of bringing organizations together to try and solve some of these challenges that you've both outlined. And the opportunities for us, it seems, to be the right kind of offer. In terms of country pilots, there seems to be a very big demand, and these grow. We don't target a country. It evolves from demand from whether it's the NGO partners in the field or donors. We find that the easiest part for us to fund is field deployments, and even in that first iteration where it's kind of a collaboration manager with some of the early first iteration tools that we would like to develop, we see that is productive in delivering some needs assessment, collaboration, mapping organizational footprints and capabilities. And I guess even just by deploying an individual, we have facilitated, let's say, 38 million in collaborations between organizations. Not to say that those wouldn't have happened anyway, but hopefully they were better as a result of a facilitated systematic conversation. And I guess there's a corresponding challenge with that. In the next year, we could easily respond to demand and do 10 more pilot countries, and we probably wouldn't learn much more from the 10th one than we would from the third one. And so the challenge is to avoid, repeating the same lessons, because there's a demand for this kind of conversation in the field. we need to do that in a way that we learn from, that we test what we're proposing, and that we are free to fail. And I guess the second opportunity is that learning from the field. So through these early pilots, we're developing solid knowledge and experience of what that facilitation conversation needs to look like, what the partnership brokering and trust building in the field that allows you to have the right discussion looks like. And also a really richer understanding of the kind of the low-hanging fruit. Some of it's not that low-hanging, but the kind of opportunities for developing the tools that would really be helpful. Whether that's the data sharing agreement template that we're using as the starting point for data sharing, collaboration modeling tool that you'll see, but also exciting new thinking that I think will be discussed tomorrow around data interoperability, data trusts. So what does it look like when you've got a database that you can ask questions of rather than have to transfer data, so that we can find different ways of thinking about the sharing of information than trying to create a hugely complex network of data sharing agreements. Are there better ways to think about that at a system level? And also, thinking about this from a social protection perspective that was presented yesterday. And I think, finally, in terms of learning from the field, the opportunity, and we're starting to do this in terms of developing a meal framework and research framework, is to be really rigorous about what's actually working, and about whether what we're doing in the field and the tools we're developing are actually delivering that better system for affected people. And I think it's easy for us to be self-congratulatory. We need to have really independent, rigorous challenge to what we're doing, to try and break down some of that business model and those incentives that we kind of set up for ourselves. And the final thing to be excited about is maybe something that doesn't sound that excited, but around our own governance and business model. So I think we're at a stage now, and we're doing the early work to try and establish MOUs between organisations, ways of working, ways of funds flowing, so that we can get the right actors in to make this happen. And that means a self-sustaining business model for the CCD, which would give us the structure and the independence to really start to live our values much more than 15 NGOs, international NGOs, getting together to solve this problem. That's not where we want to be, so that we can work towards a much more open, neutral, and adaptive organisation. And so that's a really exciting step. We need to cherish this enough to let it go eventually. And I think that comes to really a fundamental challenge over the coming years for the CCD, which is frankly funding. So this is a global good that we're trying to establish, and so it's not going to be established through funding from the outside. This is something from the 15 NGOs. This is going to be established because it has some funding from the outside, and that's and what we're trying to do is, as we discussed yesterday, difficult. It involves lawyers. It's complicated to do, and with 15 NGOs, you have a certain degree of critical mass. But we really need to get to do what our ambition is. We really need to make a move from a small amount of funding and a lot of goodwill to something much more substantial. Thank you.
Thank you so much. And one bit I wanted to pick out of that, which I think is very exciting, is making big claims, having big ambitions about what it is that you want to achieve, and then rigorously testing against those and being open and transparent about whether what you're doing collectively is helping you get there. I think that's really exciting. Thank you. So, Claire, last but not least, a similar question to you. What is the UN Common Cash Statement intended to address? And I know that it's very early days for you guys, and this is very much a work in progress. But looking to the future, in 5 years' time, what does success look like?
Thank you. What I will try to do now is very much indeed trying to unpack and maybe demystify a bit what we are trying to do with the UNCCS, and maybe go through some of the work that has been done in this past year, and then also try to really unpack the ambition and where we're trying to go, as well as also sharing with you some of the learning and the challenges that we have been experiencing for the last year. So, going back very much to why this statement and why this commitment from our 4 principles. So the idea was very much to improve the quality of a cash response while coming together, and really improving the quality of services that our beneficiaries will be able to access. And this was really the first objective, that how can we improve that, and at the same time being able to demonstrate together efficiency and effectiveness. So this was very, very much the intention. And as others have just mentioned, the idea for us is not to say here is a new UN model that will be copy past and have it everywhere. It's very much rather having a collaborative approach that will take different shape, different colors in each of the contexts where we will try to come together. So I think for us is really critical to demystify and clarify. It's not one system, it's not one platform. It's about interoperability and exchange of information and data in a way that it will be tailored to each context. And it's really something that we are trying to implement at field level. So this is a commitment that's been taken by 4 UN organizations, including 3 operational agencies. It's very clear that even if this commitment is taken by 4 UN organizations, it's very clear to us that we won't be able to deliver on that commitment by ourselves. We need to be inclusive, and we need to collaborate with a wider range of stakeholders, including the NGOs, the private sector, the government. So this was also very at the very heart of this statement, is how do we do it with others. And the other key element is that the intention is to come together, but to come together at the very beginning of a response. And instead of trying to fix something once we have realized it's not working, we're trying to do it together at the very beginning, at the very start, and create predictability, not in having, as I said, one model or one global division of tasks between ourselves, but very much building predictability in terms of systematic sharing of information, systematic consultation at every step, or at every step of a cycle of a cash program. And it's really something that is really driving the way we are trying to implement this. So in terms of opportunities and what we have been trying to do this year, I mean, as you might know, we have 6 focus countries where we have been trying to start applying and implementing this collaborative approach. The statement is building on 3 pillars. One is very much on improving our ability to transfer cash to beneficiaries, so very much procurement of financial service provider. The other one is on data management, beneficiary data management, and the third one is more on what we call the soft elements of the design of a cash program. So what we have been trying to do is very much developing, building this predictability in the way we work together on learning how we can define rapidly roles and responsibilities for every new country where we're trying to do that, and really not again having this one model, but having a cornerstone approach that is implemented in an open and transparent manner, where we can consult and decide how are we coming together as a group to implement cash assistance. And to do that, it was very clear that on some aspect, on procurement, on data management, there was a need to have global tools, to have global policy to be put in place at HQ level, because it's not true that we can just ask our country offices to come together if we don't equip them properly to do that. And as you all know, the UN financial rules, the UN procurement rules are very heavy and so on. So there was very much a need to harmonize and simplify this for our country office to feel empowered to be able to do that. And this had to be done at HQ level. And this is very much true on the data management aspect. If we want our data system to come together, this requires global approach that are very complicated and very complex and require a lot of work in terms of adjusting our policies, adjusting our legal framework to be able to do that. So this is something that we have initiated this year. We have, on the procurement, we have come up with a global collaborative procurement guidance for our country offices. To be able to, it's like a menu of options that is being rolled out to all our country offices for them to be able to come together in terms of procurement and really achieve more efficiency on that aspect. What we have learned also is that a joint transfer mechanism, such the one card that we have experienced in Lebanon, is not necessarily what we want to achieve everywhere. And that it's rarely possible to have that approach, that on the contrary, each decision on transfer mechanism has to be very much grounded at country level to make sure that we do have this people-centered approach that is very one of our core commitment to achieve. And we have seen in countries like Afghanistan, Niger, where there was added value to have more than one transfer mechanism, as long as it was done in a collaborative manner and consulted among us. So it's one aspect that on which we are going to continue to build. On management of beneficiary data. This one, I think, is the one that is the most ambitious and the most complex that we have to achieve. What we have been able to do is to agree on a common data set for registration of affected population. And we have done that in an open manner with other organizations like IFRC, IOM, the CDD, where we were trying to make sure that whatever we will agree in terms of common data field will something that also will be shared by others. Another element is data protection and data sharing agreement. How can we develop the global framework that will allow our country offices to share data in a systematic manner when needed? And this is where I think we are unpacking many layers of complexity that we really have to equip ourselves to be able to address them. And the other aspect is very much building on identifying entry points for interoperability. We all have different data systems. The idea is not to make them become one, because we know it's not realistic, it's not feasible, it doesn't match with the way we are structured. But the idea is to have more, is to facilitate the action of data through this interoperability mechanism. So just very quickly, we have seen in our 6 focus countries, we have seen examples where our country teams were able to come together, for example, on doing joint market assessment, joint financial market assessment in Central African Republic. In Niger, we have seen our country teams being able to come together on joint procurement of financial service provider. In Yemen, we are doing a mapping of interoperability on 3 points for our system to speak to each other. So this is only examples of what we have been doing this year. But the ambition of this statement is bigger than this. And I think when we trying to respond to the question what success would look like in a few years, I think the idea is very much for us to the way we will be able to measure success is that if we are able to shift the way that our teams are functioning at field level in terms of spirit, in terms of having them being able to systematically exchange information without questioning why they are doing it, just for the sake of it. And that it becomes something that is natural for them before starting a new contract, starting a new initiative, that they consult with others. And I think it seems simple like this, it seems simple on paper, but really trying to support this does require a lot of work, and it's really something that we really want to see happening. The success will also look like in having an agile and tailored response that are context-specific, that are being facilitated by global tools, global framework, but that are really context-specific. Another aspect is very much on the data. What we would like to achieve is having a dynamic list of beneficiaries that can be accessed from one system to another to avoid having duplication and support a tracking system that will make sure that we are covering all affected population. And this is really why we want to have this common data approach, is to be able to do that, avoiding duplication and making sure that no one is left behind. In terms of success, we also want to make sure that whenever it's possible, we are linking with government system. So when we said that we want to have an agile approach to this, is being sure that we are able to build on what exists in any context, and not just coming in with a new approach regardless of what is already there. And it's something that is on which we have a lot of progress to do. And the other aspect in terms of success is being sure that we can protect the data we are collecting from beneficiaries. And on this, we are really struggling, and it's really something that we want to measure more and more. Last point in terms of challenges and what we have experienced, not that it is a surprise, but I think, as I said, the biggest challenge is very much around beneficiary data management. And how do we manage identity, how do we exchange data is really something that requires time and investment, and collective investment, which is not always easy to achieve. And another element for us is that what we want to make sure in terms of challenge, that when we go at scale, especially when with large funding and when we're trying to really coming together, that we don't see efficiency being privileged or being given priority over effectiveness, over good quality programming. And it is really a challenge that we would like to address. Another challenge that if we come together, if we collaborate, there is a need also to see the donor ecosystem, the donor approach, and possibly the common donor approach, to really understand how they will be articulated to this, and how they will speak to that new collaborative approach is something that we will be also very keen to explore a bit more. And the last learning we had is like changes like this, collaborative approach implementation does require resources. It's not true that we just need to say, oh yes, we want to change the way we work. We have experienced it big time this year. Is that to be able to do that, it takes a lot of time, a lot of investment, and by default it takes resources. And it's something that our organization has to really understand and address, that to be able to do that, it does cost a lot of money.
Brilliant. Thank you so much. So we were going to save questions to the end, but so much has come out of this panel that, with your permission, we'll keep going a little bit and then reorganise the time. So we'll make sure that we don't shave too much time off the rest. Let's do a quick 10-minute round of questions for our panellists now, and I'm going to take advantage of having a grip on the microphone to ask the first question, if I may, just to pick up on this kind of interesting emerging analogy about gardens and houses that's going on. To Claire, for my own understanding, is what you guys are building, is what you guys are working on, do you see it more as one of these big platforms that Lars Peter referred to, around which other actors will work and fill gaps? Or do you see this more as an organising principle for the garden itself, a kind of set of standard operating procedures under which potentially all actors in country would operate, if that makes sense?
You want me to reply now?
Yeah.
We don't see it as a big platform, for sure. It's really not the intention. A set of organized principles, yes, of course. Are we going to be able to do a bit more than this? This is really what we are trying to articulate and really test now. I think that organized principles is fine, but we also need to add to this tested experience, and really how do we come together to implement those principles? So it doesn't mean that we will have one way of doing it. As we said, I mean, it has to be context specific, but I think we need to do a bit more than just organized principles. What does it mean exactly? As we said, it's not a model, but I think we need to add something more to that. What is this something more? I'm not really able to tell you what it is. It's a bit too early, but it's more than this. We have to make it practical. and we really have to ground it into our ability to implement program. But the organized principles that everyone can access and work on and be part of it, yes, definitely. This is really where we would like to go. And the one platform is not feasible. It's not what we are trying to do. So I mean, on this, we are being very realistic. Yeah.
Let's take a round of 3 questions from the audience, if there are 3 questions. Yes. Krista, and then Mamta, and then Paula.
Krista?
Hey, Krista Lincoln from Danish Church Aid. I have 2 very short questions. First for Lars Petter. You are all outlining the possible future of the humanitarian cash ecosystems with cash platforms, accountability actors, etc. How do you see the role of local actors in that future system? My second question is for Rosie. We've heard so much about less focus on competing and more on collaboration. Yet your own grant awarding system is highly competitive and kind of a reason why we are competing so much. Any insights from you or answer to how we can incentivize to change the system towards more collaboration? Don't worry, I asked the same question last month at the NetHope conference to one of your directors, and his answer was, don't expect too much.
Thanks. And was it Mamta?
Thank you so much. I'm Mamta from CashCap. I think you have taken one of my questions. So my other question would be, we are discussing about 5 years. So are we trying to say that the 5 years is our pilot period, or I couldn't understand like if there is any benchmark for the pilot period as such. Following that, in regards to collaborating with other different initiatives, is there any kind of global discussion between the CCD and Common Donor Approach and UNCCS? And if there is any, what does it look like from your side? That would be interesting to hear as well. Thank you.
And then it was Paula. Yeah.
Hi. Thank you for a super interesting panel. My question is for everyone, but it's based on something that Claire said. And you said you have this aspiration to really shift the way things work in terms of spirit, right? So that to me sounds that you want to change people's behaviors. And if you look at a lot of things that go off in terms of coordination and collaboration happen at the individual level, and the things that work brilliantly tend to work at the individual level. So I'm very happy to see that you're considering behavior. So my question is, what are you guys doing to change behaviors? Because I hear a lot around changing systems and data interoperability, but I haven't heard anything in terms of making people really want to work together at the individual level. So I would like to know more.
Brilliant, thank you. So we'll take that round to start with. Maybe, Lars Peter, if we can start with you on the role of local actors in the future ecosystem.
Yeah, excellent question. Right. So if what I sort of outlined will happen, then that's going to be a more competitive system. Right? You're going to have a couple of platforms competing against each other, and basically their interest, they will be incentivized to get the best possible team into their camp. And I think that local actors have comparative advantages in a number of functions around both the last mile delivery in country, in terms of a vibrant civil society functioning as checks and balances to a big cash delivery system, advocating, leaving nobody behind. So I think actually, if you want to stick to market terminology, I think the market for localization will grow under this model because it makes a lot of sense. And it'll help you to deliver better services. And so naturally, there will be, I think, even competition for getting the strongest local actors. And it won't be localization, it'll be setting the strongest team, of which they will naturally be part.
Great, thank you so much. So, Rosie, why don't we go to you next with that very mean question? What can DFID do to help support collaboration over competition?
I'm glad you've asked the director, so you have the party line already, because I'm very much on the policy side. I certainly didn't mention that we want less competition. And I think maybe just building on what Lars Peter has said, I think it's about everybody competing to do exactly the same thing, is something that I think will need to change. Where I think donors are, and there is a conversation about this, but there's more that we need to be doing to play our part, is there's lots of disincentives to specialise, to take any other role in cash rather than an end-to-end system, because of the way that funding is allocated, particularly around some of, I'm getting really into the business model discussion now, but I think the fact that there's disincentives in the system to change is something that donors recognise and perhaps aren't moving on as quickly as we all would want to, including ourselves. But I think in terms of competition, I don't think competition and collaboration are mutually exclusive. I mean, they sort of are, I guess, at some point, but they shouldn't be in terms of making a change on that.
Brilliant.
Shall I move on to... Yeah?
I
was going to take on to speak to Mamta's point around if there is a common dialogue, and just to say that there is, and that we've been discussing, and I think it's very much along the lines of what we've been talking about today, like not talking about how is these operational models going to be set in the system and how is it going to look, but it's about where do we have shared, where is there commonality and what we want to achieve moving forward.
Thank you. So maybe then if we put Paola's question about what are you doing to change behaviour to both of you, one after the other, maybe Claire, if we could start with you.
What are we doing? Yes, this is the main bottleneck. I think it's a question of incentive for our colleagues on the ground to really understand and feel that there's an expectation that they need to do it differently. So it's really for each of our organization to create this incentive scheme for colleagues to really see an added value in doing it differently. And this is not going to happen in a year or so. We know it's going to be it's a long-term objective, but it is very much the condition for us to be able to function differently at field level. So I know that, for example, we have started, but we need to be stronger in saying that for us, the benchmark for success is to really check whether any cash operation has been done through the right level of consultation and collaboration. And we have ways to check that, and we have ways to really create the incentive for our colleagues to report on that and feel that the expectation is also on that, not only on the results, but also on the how to, and have we achieved these results. So this is really where we have to, I think, to strengthen our efforts and get stronger.
Thanks. I think it's a great question. It's one that we recognise right from the start. That we can't just come up with a load of tools and hope they'll get adopted. And a real area of focus is on the behaviours that start with those collaboration managers, but also with members of the network, so that in the field we develop that atmosphere of trust and those behaviours of willingness to, understanding that we should all be trying to differentiate more, and I guess taking away the lessons on partnership brokering, on collaboration, I guess the science behind it that opens people up to a different kind of conversation. And that starts, I guess, with the kind of actor mapping that we do. That needs a certain degree of transparency that, when you sit in a coordination meeting, you very often don't get. But when you are working towards trying to create a partnership, you really need. And I guess, if over time we can develop the kind of partnerships or expectations across the network, but also skills within our collaboration managers, then we can develop a kind of really smart way of facilitating those conversations and a really insightful understanding of the incentives that are kind of driving behaviours. And I think that's where we need to start and continue to develop.
Brilliant, thank you. For the sake of symmetry, we're going to start the next section at 11:15 and run it to 11, so we have the same amount of time. So we've got time for one or two more questions if anyone has burning issues now. Karen.
This kind of picks up on a point that you made, Rosie, and a few other points that have come out. But in here we're talking constantly about collaboration, and it's almost as if everybody fits within the system. How much have you seen a willingness to give up so far? Because in my experience that there are those times where actually to be the most effective, people have got to step back and say, actually, we're not best placed. Are we willing to do that?
Annie, let's take one more question.
Thanks, everyone. Great panel, great conversation. My question is about, surprise, surprise, on how much you've seen use of technology play out to the advantage in this collaboration discussion, and how much has been the smokescreen.
Great questions. Thanks, Kalpis. Okay, how are we going to split this? I think, why don't we, on the are people willing to do less and give up, why don't we start with Lars Peter, and then Dominic, if you could comment on that also.
Great. So the ODI did this report called Time to Let Go. I always thought that should have been called, we will now take this away from you. I don't think it's a question of willingly giving up, and I don't think that that's how disruption works. I think what you're hearing is we're putting in place an infrastructure which really has economies of scale. And once that's in place, the value brought by some of the access to the table is going to be very little. And I don't think they'll have a choice. I don't think it's I'll now let go of this.
Yeah, I mean, I think I can only speak personally or from an organisational perspective. You know, I think within Save the Children we see the writing on the wall on this and see the need to adapt. And you know, that's difficult across a big organisation to try and achieve that. But I guess the support that something like the CCD gets internally is a real indicator of the willingness to give up. And it's not, and again, it's not universal to support, but it is very, very clear in senior parts of the organisation that this is a really important initiative. And I think we see that across a number of the NGOs, that we're kind of trying to find our place, and the logical next step is looking into this kind of area and trying to find a different way of working in a different niche, and that's, you know, that's I guess in terms of how ready are we to give up, we're starting along that road, I think, is the best answer, and it depends. I think how successful this initiative will be a really good indicator of that.
I just had something to say on that. I think it is about giving up, but it's also, we're still assuming that our only objective is to deliver cash, and I think that's what people are giving up. And this presents us with an opportunity to make space for other things that we're still not doing properly after decades. So I think we're giving up something, and we're making space for the opportunity to do something else much better. So it sounds very sort of egalitarian, but I think it's what we're trying to look at through this, improving our understanding of value for money. But it's, you know, it's not just about cash. It is about different modalities. It's about changing the way we do multi-sector, etc., etc. It's the start of the future.
Much better put.
Claire, that leaves you with a very tricky question. And let me just check that I'm paraphrasing this right. So, to what extent is technology enabling better collaboration, driving better delivery? And to what extent is it getting in the way? Probably right.
Sorry, could you say that again for the live stream?
Oh no, I've already mangled Anna's brilliant question. I'm now going to make it worse. So to what extent is technology driving collaboration, enabling us to deliver better? And to what extent is it getting in the way, tripping us up?
Okay, on this I can speak to our experience on coming together on interoperability and exchange of data. For sure, this can only be achieved through a technology solution. The question is which one, and how can we go at global level with that? And I think it's really a difficulty that we have experienced. We have many tech solutions that are being offered to us now. The question is which one is the right one, and how can we mobilize our investment to support more than one, because we know, our core approach is to be context specific. So one tech solution in one country might not work in another one. So this is where I think is how can we equip ourselves to be able to be compatible with more than one tech solution, and then how do we enter into that market, and how do we negotiate and so on is also another difficulty. So, but we want to see the tech solution as something that can really facilitate the process. And I think when it comes to data, there is a need for very strong tech solutions that are safe, that are secure, and so on. But then the question is, how do we make sure we don't only pick one? And I think biometrics is one element on which where we see agencies picking one solution, and then after we have to make them compatible. This creates a lot of difficulties. So we need to find a balance between making sure we have the right market price through competition and so on, but at the same time that they are compatible. So it's a difficulty, but I think right now we still want to see the tech solution as something that can really enable more collaboration than the other way around. But this means using open source technology, not really going into proprietary solutions that are being then very difficult to collaborate around. So there is many caveats and nuances that need to be added to the discussion to really qualify to which extent tech solution can really support us and not the other way around.
Thank you so much. So we've already run quite a long way over. There'll be more time for questions at the end. But for now, please join me in giving our excellent panelists a big round of applause. And we'll say goodbye to all of you for now. Some of you, you'll be seeing some of these faces again later in the day. And without further ado, handing over to Hélène Juliade to take us through this very exciting piece of research, drivers of value for money for end users. Over to you, and take until 11, so you've got the same amount of time. Okay. And then here's the clicker.
Okay. I don't have enough hands.
If you just want to shout slide at me, I can do it for you.
Hi everyone. Is it okay? Can you hear me okay? Okay, cool. Thank you so much. Better? So the idea of the session now is to present you with the preliminary finding of our study that was commissioned by DFID. The study is to be published by the end of the year, so it's coming soon in terms of the final findings. I guess it's going to build as well a lot on what the panelists have said in terms of what are the opportunities to move the debate from cash at scale, efficiency, towards quality as quality representing effectiveness, sustainability, equity. So I'm going to give you a bit food for thought to move into the session afterwards. In terms of the scene setter, as we all know, the increased uptake of cash and voucher assistance to deliver humanitarian aid has been a catalyst for change, right? Innovation on how organizations collaborate with one another. And so these changes, they have the potential to reinvent how we deliver aid, and more specifically cash and voucher assistance, and how aid reaches its end users. And end users are at the core of the research, which I'm going to present now. And so what we are exploring is how those different models, even though we shouldn't be talking about operational model, as I understand, I'm going to be talking a little bit about those, but more importantly, how those models have the potential to reshape the whole of cash system. And I'm coming on the terminology buster. And so this DFID Commission research aimed to contribute to the proof of concept of informed decision-making on specific design to deliver cash assistance. So the focus are specific decisions that humanitarian actors make when they design how they are going to deliver assistance, cash assistance. And so the objective was to align those decisions with both end-user preferences and expectations, as well as more traditional value for money consideration. So it's a mix of both, putting end-user at the center of the research, while at the same time exploring the usual suspect, right? Cost to transfer ratio, and so not turning a blind eye to efficiency and economy, but also bringing in more to the pot of value for money. And so basically the research question we aim to answer is the one written on the slide, right? Is to what extent is value for money of cash assistance influenced by critical design-related decision? And so those decisions I'm talking about, there are three that the research examined. Number one, the use of a unified delivery platform. Number two, the use of existing social safety nets to deliver assistance. And number three, the consolidation of cash transfer. And so the research reports document evidence about how those influence value for money of cash assistance as perceived by end users, but also as could be calculated by humanitarian organizations. In addition to the research, which reads quite a lot of detail in terms of different examined case study, there is a how-to note that will offer practical guidance to decision maker on key value for money consideration. So basically question that one should ask themselves when designing a cash program. Not saying we are going to provide all the answers, but at least trying to organize the question that we think are important. Very quickly, before discussing finding and the methodology, and I'm going to be brief on methodology, just a couple of points in terms of scope. So when we were asked the question about those design-related decisions, we needed to take a step back and look at what is an operational model. And so we developed for the study a layout or a taxonomy of what an operational model means. So CALP has defined operational model as the platform as to how organizations work together. And we found out that there are actually 3 layers that define how this platform functions, right? A contractual layer, so how do organizations work together either independently or more formally via a consortium. Programmatic arrangements, do they deliver multiple programs via this operational model, or do they deliver just one single program? And which type of grants do they deliver? Do they deliver multiple sectoral grants, or do they deliver consolidated grants? And finally, the delivery model. Yeah? And so the delivery model could be the use of a unified delivery platform or business as usual. So basically, and this is, again, proof of concept phase, but so far we've been able to describe every operational model using those 3 different layers, right? And one is not exclusive of the other. So if you remember the 3 design-related decisions we looked at, 2 are about delivery models, so the use of unified delivery platform and the use of social safety net, and 1 is about programmatic consideration, so the use of consolidated grant, which mean that the different decisions we looked at are not exclusive to one another, yeah? Because you can very well distribute consolidated grant via a unified delivery platform, and if you push it a bit further, you can have existing social safety net delivering consolidated grant via a unified delivery platform. So those decisions are not exclusive from one another. In terms of the framework, I'm going to spare you the 4E framework. It's the standard one from DFID. The important bit to note is that we added sustainability to the mix. So actually we looked at 4 traditional criteria and the sustainability bit. And as if it wasn't enough, we decided that as opposed to look at simply operational model, what was interesting if we wanted to place the lens on the end user was to look at the whole of cash response. So the whole of cash response has, as we've defined it, is in a given geographical area, if you have one crisis-affected household group, it is the combination of operational model that deliver assistance to this group. Yeah, so what is homogeneous is the group, the crisis-affected household group, but not necessarily the different operational model. If you take Rohingya refugee in Bangladesh, they may be receiving assistance from a unified delivery platform run by a couple of organizations or one traditional program. So from an end user perspective, operational model is not necessarily a very relevant lens of analysis. It's more how all those operational models work together. And we also decided that cash working group, or not decided, but thought that cash working group wasn't an operational model per se, right? But that it's rather the link or the binder in between those different operational models and how they coordinate, or even more so, collaborate, right? So if you think about the lens of analysis of the research, there are actually two. One within the operational model, and a second one, which we think is more interesting, which is in between those operational models. And this is really where you can bring in the end user perspective, yeah? Because an end user doesn't necessarily think in terms of operational model, but is rather looking at the breadth of assistance that he or she is receiving. So in terms of the methodology, we've approached value for money as an evaluative question, right? So there was a study protocol with an evaluation matrix, predefined indicator for each of the design-related decision, and each of the value for money criteria. And to make sure that we really rooted the research into what was happening right now, we picked 4 case studies that you have here. This was the thought process, right? And in those 4 case studies where we collected primary data and secondary data, we added on global literature, right? So there is a focus on the research on those 4 case studies, and it's complemented by global evidence. So if you look at the 3 different decisions that we looked at, they have been studied across not the 4, except for consolidated grants, but sometimes 2 or 3 countries, yeah? So this bit is to say that originally there was a question about segregation of function, right? In a similar fashion that we wanted to look at grant consolidation or use of a unified delivery platform, we also felt it would be relevant to look at segregation of function. It hasn't been possible to do so because of competing research priority, right? So the research is focusing on those 3 areas. So the interesting bit now, right? So the findings. So the first slide, which is a visual. So this slide basically summarizes the different key indicators that the research examined, yeah? So what we did is that for each of the 4E and sustainability, we identify, and this was our research hypothesis, key drivers that we felt were important to investigate, again, bringing in the end user perspective, to see to what extent they will have an influence on economy, efficiency, and so on. Now you see like those cells, they are of different size, okay? And so the size of the cell reflects our qualitative perception as researcher, as the extent to which those drivers influence this particular indicator of value for money. This different colored is a Russian doll system. So if you look at economy, you see that the primary driver of economy is delivery cost. Yeah, that's a no-brainer. But delivery costs entail transfer fee, information management system cost, as well as governance-related cost. And again, following the Russian doll system, transfer fee are determined by scale, which in turn is both determined by the total volume that you're going to channel, as well as the size of the individual grant. And so same goes with this one in terms of the Russian doll system. So a couple of things, I'm not going to discuss each driver in turn, but a couple of things that emerged that are interesting is that some drivers cut across multiple elements of value for money, but some are very specific to effectiveness, equity, or sustainability, which mean that there will always be trade-offs. Yeah, so there is, and this builds also on what the panelists have said, and Rosie specifically, that there's never going to be the perfect way to collaborate. Yeah, there will always be trade-off in between one of those criteria or multiple criteria. So the value for money and the quality of cash assistance is actually not necessarily to be sought via one single operational model or way to collaborate, but rather to be sought via the whole of cash response system. Yeah? So if you really want to place yourself in the shoes of crisis-affected household, you will never be able to ensure cheap, efficient, effective, as well as equitable and sustainable assistance via one program or one single operational model. So how do you reach out, collaborate with others, so that the programs, multiple programs you design, actually cut across those elements? And so the research report examines each of those drivers, because we've collected data about each of those, right? So what I wanted to present here was just the key highlight per each of those decisions, and then discuss a little bit about the trade-offs. And I have some conclusion that actually also cut across quite nicely with some of the question you've asked about localization, etc. So the first one is the use of a unified delivery platform, right? So to what extent, if organizations decide to use a unified delivery platform, does it provide better value for money for the end user as well as for the organization? So the use of a unified delivery platform is one way to achieve scale. Yeah? Hence, it can provide efficiency as a result of the scale. So as a result, using a unified delivery platform may contribute to reducing transfer fee because it's going to give more buyer power to organization. But this necessitates that, one, organization use this buyer power, which hasn't always been the case, and second, that the financial service provider landscape offer competition. Yeah? So we bring back to the question about should there be competition? So when it comes to FSP, actually, if the use of a unified delivery platform is to bring in additional economy and efficiency gain, it needs to be in a context where the FSP landscape is mature enough, so there could be competition in between the FSP. The use of a unified delivery platform also presents opportunity to reduce cost from an end user perspective. But again, two major caveats. One, there need to be an overlap of beneficiary in between the organization using the unified delivery platform, because if you have multiple organizations who use the platform, but they deliver project in very different area, it's not going to present any cost, any gain, for the end user. And number two, organizations need to coordinate their distribution, right? So, and this is quite consistent with all of the findings. There is no mechanical effect or effortless effect of design-related decision on value for money. It always requires, and this is a point that Claire made, it always requires resources and effort. Yeah? You cannot say, we're going to use a unified delivery platform, it's going to save cost. No, it's going to require effort, and if you did a proper job, then it's going to save cost. In terms of the effectiveness, there was an assumption here in between humanitarian organizations who felt that using a unified delivery platform will simplify and limit the number of interactions that end users have with humanitarian organizations. And as a result, that it would be more effective from a communication point of view, as well as more equitable in terms of being able to access payment instruments. Because you basically have to overcome those barriers only once. But if you talk to end user, actually it doesn't necessarily prove true, right? So in terms of communication, end user felt that there was really a risk of diluting the communication channel. And so this is quite a simple graph that actually explains that when using a unified delivery platform, organizations don't give up communicating directly with end user. And in addition, you have an extra layer of communication on how to use the payment instrument. So actually, you're going to have one communication on the cash out process, which is either done by the FSP or by one of the organization running the platform, and then multiple communication, which are not always coordinated about what's the objective, what's the programmatic element of the different cash and voucher assistance that end users are going to be receiving. So again, there is no direct or mechanical effect in between effectiveness and the use of a unified delivery platform if there is no effort by humanitarian organizations to coordinate and align delivery. Yeah? In terms of the equity and access to payment mechanism, in all the contexts we've studied, the use of a unified delivery platform meant that organizations used a single FSP as well as a single payment instrument. It doesn't need to be, right? You can organize yourself using a delivery platform and have multiple FSP, or at least have one FSP and multiple payment instruments. But for now, also acknowledging it's the start, there has been one single FSP, one single delivery mechanism when organizations have used unified delivery platform, which means great. Maybe it's easier for end user to overcome those barriers. But it also means that there is a risk that by having at-scale delivery, there is also certain rigidity, right? If you want to serve the many, then it may be at the detriment of those who have extra barrier to access assistance. When you have an end user that has multiple payment mechanisms accessible, there is one way or another that he or she can make one work. But if the household is stuck with a single payment instrument, then those barriers that indeed he or she just need to overcome once become paramount to overcome to access any form of assistance, any form of cash assistance. So you're reducing the number of barriers, but potentially increasing those barriers as well. In terms of the use of social safety nets, so one of the primary findings of the research is the fact that you cannot describe using social safety net as one design-related decision. Yeah, it is more than this. It is actually a multitude of decisions. So that's one. Having said this, it doesn't necessarily bring a lot, but it's to say that this is how it's going to influence value for money is going to be the result of those multiple decisions. Again, it's not because you're using social safety net that it's going to be more equitable, more sustainable. It is how you shape this linking that's going to have an effect on the value for money. And here, reverting to also what the panelists have discussed, we also realized that the key determinant of value for money when linking with social safety net are contextual factors, and especially the design in the initial social safety net program and how the linkage is being done. So it's not simply linking with social safety net that's going to bring some gain, it's how you link. And if you decide to piggyback or if you decide to do an extension, horizontal extension or vertical expansion. And so piggybacking, for example, a separate program on some of the safety net operational system can allow more flexibility, but it can also provide fewer opportunity for sustainability. And on the opposite hand, if you bring in some shock response elements into long-term social safety net program, it can take a significant time to set up, but is potentially more sustainable. So again, here, bringing in the element of trade-off. And whatever the approach, however, in terms of linking with social safety net, there will always be added value in assessing, negotiating, and preparing ex ante. Yeah, so it could be an element of preparedness that will raise value for money when a crisis hits. In terms of the efficiency bit, so linking with social safety net has the potential to improve efficiency due to the use of existing infrastructure and system, provided they are strong enough to accommodate emergency cash delivery. Program scale, as enabled by the use of social safety net, is a key driver of the cost transfer ratio, which in turn is going to boost efficiency. However, again, bringing in the trade-off, working through national system require negotiation, coordination with a range of stakeholders, more than if you're just delivering under business as usual model. And certain design aspects can raise political issues, which can in turn negatively impact the setup time. So it's going to be more lengthy to link with social safety net. And it may also create challenges in terms of setting up the transfer value, which will negatively affect effectiveness. If you have, and there were a couple of examples emerging from the research, if you have country where there is an obligation to align the transfer value with the transfer value that is regularly delivered through the social safety net, then the emergency cash value may not align with humanitarian needs, but may be driven by other non-humanitarian factors. So a risk here, it's not always proven true, but it's a risk to keep in mind from an effectiveness point of view. One interesting aspect as well is the fact that refugee context will present specific drivers. So registration cannot be completed ex ante. Yeah, so that's one of the benefits that cannot be realized in refugee context. And there can also be greater political issue around the inclusion of refugee in social safety net program. And so compare, in terms of sustainability, compared to delivering through parallel system, using social safety net can bring in more sustainable outcomes. But again, this is with in mind the fact that there has been specific efforts towards sustainability. We've seen quite a lot of assumption in terms of financial inclusion, or that by using a card or by using mobile money, people would be better linked with the financial system. Financial inclusion doesn't happen as an unintended outcome. Yeah, so if there isn't any specific effort, resources dedicated to it, it's not going to happen. So the last one, in terms of grant consolidation. So as we discussed, grant consolidation, it's not part of a delivery model, right? It's really looking at programmatic arrangements. So you can have distribution of consolidated grant, irrespective of the channel you use to deliver it. So it doesn't pertain to specific delivery model being used. Consolidating multiple grants in a single transfer has a mechanical effect on the number of grants to be distributed. Yeah, if you compare it with similar amount of cash being distributed via sectoral grants, the effect in terms of the reduction of grants is mechanical. So in turn, it can have a positive effect on transfer fee, which then in turn will link to efficiency and effectiveness. Yeah, if you have less grant to deliver, then it's going to be cheaper. That seems quite logical. And so here, this is a little summary graph that go beyond consolidation, but is there to actually recap what are the different elements that are going to have an effect on scale, which in turn is going to be the primary determinant of economy, as well as efficiency in terms of influencing the cost to transfer ratio. And we see here that grant consolidation don't necessarily have an effect on the overall amount of cash that is being channeled, provided organization would distribute similar amount of sectoral grant, but it has an effect on increasing the size of individual grants. And depending on the cost structure at FSP level, so the more fixed cost vis-a-vis percentage of transfer fee, the more gain you're going to have by consolidating transfer. Yeah. I realize it's a lot to take on, right? So it's all documented in the research. So that's in terms of the efficiency. In terms of the effectiveness of the program, and this again is not the sole result of the research, but has been documented multiple times. So there is a correlation, a positive correlation in between grant consolidation and the ability of end user to meet needs. Yeah, because households prefer to have larger, unrestricted cash that they can prioritize the way they want. From a communication point of view, similarly, the fact that grants are consolidated also have positive effect on how end user perceive the effectiveness of the communication. Because as opposed to have multiple channel of communication, there is only two, or that's an example. So it's really streamlined communication, hence making it more clear and more effective. In terms of the sustainability, and that's a similar finding for the use of a unified delivery platform, actually none of the platform or none of the grant consolidation program that we've studied, they used a financial instrument that was meant to be used beyond the lifetime of the project. So there was, and this was interesting because there was perception from humanitarian practitioners that by using a card or by using mobile money, there would be increased financial literacy and later on increased financial inclusion, but the cards were not transactional. So they were not designed in their first place to be used after the end of the project. So this assumption is not proven in evidence, in the sense that it's not even meant to be used after the end of the project. So a couple of trade-offs to finish with before the conclusion. Yes. So the research acknowledged that there will always be difficult decisions to make at design stage, right? So the research objective is not pointing finger, but it's rather to illustrate meaningful questions to be asked, so that they could be reflection not only within an operational model, but within the whole of cash response system. And I guess this is really the primary objective of the research. One thing that is also coming quite clearly is that by all the design-related decisions we've looked at, they had as an objective to mainstream the delivery of cash and potentially increase scale. And scale has indisputable effect on economy and efficiency, right? So there is an economy of scale, which is indisputable. However, what we found out is that there is no effectiveness of scale, there is no equity of scale, there is no sustainability of scale, hence there is no value for money of scale. So the debate needs to really shift from delivering at scale to delivering quality, okay? And something that was also mentioned is that collaboration takes time, right? So the use of a unified delivery platform, for example, will always be worth the effort if it's for repeated distribution. And so the efficiency gain and the effectiveness gain in terms of the timeliness of delivery is expanding as per the duration of the program. The longer the program, the longer the delivery, the more gain there can be in using a unified delivery platform. Same goes with creating an MEB, right? We know it is a difficult process and working with others is difficult, so it is only worth the effort if it's to be sustained. Another point, because in the efficiency, in addition to the cost to transfer ratio, we looked at the accuracy of targeting, is the fact that some large-scale program, especially those that are using social safety nets, they are actually using proximity testing as a way to target, right? And so we found a tension in between the efficiency of targeting and the speed of targeting via those methods, vis-a-vis the accuracy and being able to capture vulnerability linked to a particular crisis. So proximity testing is basically looking at poverty, whereas sometimes we humanitarian, as a result of a crisis, we are looking at vulnerability criteria which are not only linked to poverty. So here there may be a tension in between speedy, at-scale targeting vis-a-vis accuracy of targeting. And so I guess it's one of the primary trade-offs that emerge is scale is great, but scale also very often entails rigidity. So how can we, as humanitarian actor, be humble and reflective about large-scale delivery and bring in more niche operational model? And that's going to be the conclusion, is to say that if we're looking at the whole of cash response system, there is a niche for more agile and smaller operational model that have the capacity and the flexibility to reach out to those who may be harder to reach because they don't have an ID, because they don't know how to use a credit card, whatever. Yeah. So there is a point of attention that we are not forgetting a bunch of the crisis-affected households who also deserve assistance because we are getting better to deliver for the many. Another point of attention is that we've seen quite a few assumptions out of goodwill, right? We're not at all challenging the goodwill of practitioners coming out as a result of the study. There is, for example, an assumption that when end users have use of a single payment instrument, it would be much easier for them. But actually, if you talk to end user, they're going to tell you that it's maybe easier, but also scarier, because if they lose the payment instrument in question, then they are stuck, not receiving assistance. And sometimes those models, which are large and quite rigid, they don't allow back payments. So it means as a crisis-affected household, you lose your card, it's going to take 2 months to get the card replaced, and you're not going to receive assistance for the 2 months during which the card hasn't been in function. So, and again, this is something that has been said by all the panelists, but that is evidenced through the research via anecdote and looking at those case studies that out of goodwill, we are making assumption about preference and expectation of end users. And value for money actually allow to capture those perspective and expectation. The importance of contextual factor, we discussed this, I'm not going to spend more time, but the last bit that I think is quite important to mention that build on Chris's question is the fact that this wasn't a question or an indicator that we specifically looked at, right? But when we wrote the research report, we were like, oh, okay. So there is actually one stakeholder that is absolutely missing from our research. It's local organization. Never, ever have they been involved into making those decisions that we looked at, and they haven't at best, and they have at best been informed. But they have never played a role into making those decisions. That's it.
Brilliant. Thank you so much, Helen. And we've got 5 minutes in case there are any burning questions or comments on that brilliant presentation. Lots to take in. Thank you. Any quick thoughts?
Thank you. This was really interesting. One question I had on perhaps contextual factors is the effectiveness analysis and sort of how this is linked to services and sectors, right? You link to social safety nets, fine, but how do you look at an operational model effectiveness if people get money and they can't access healthcare, for example? I mean,
Let's take a couple more. Catherine, over to you.
Thank you very much. My question would also just look at the quality of those services. I'm sure, we're looking at value for money, but as you said at the end, we're looking at what is it from a user perspective, what does that look like? Because many services may be provided, but the quality of the healthcare service, for example, could be completely undermined by lack of doctors, lack of whatever, equipment and so forth. So I think that question is critical, as is the question, I'm a bit questioning the sample collection, because those country contexts are relatively stable, have a relatively good infrastructure, and it's a relatively, I would say, stable crisis-affected population. They're not moving around, except maybe Colombia. So if we're looking at CAR, Central African Republic, how does that look like there? what does it mean for the need for agility of actors that are adaptive and they're proactive in anticipating displacements, change of delivery mechanisms, change of actually, modalities from in-kind to cash to voucher, again back, and completely dilapidated services possibly. Thank you.
Great. And then, yes, go ahead.
Hi, sorry. Thank you very much. That was a very, very interesting presentation, and I was really looking forward to hearing about this study. My question is a simple one. What are your recommendations, particularly given the discussions we had this morning?
Brilliant, thank you. So all other questions, I'm sorry, we're going to have to wait until over the coffee break with Hélène, but if you're happy to give those a go.
So a couple of things. On the question regarding quality of services and capacity to spend money, I guess this is part of the scope of the study was to look at how the value for money of cash assistance is influenced by the design choices and not necessarily by the choice of cash as a modality, which I believe the effectiveness of cash as determined by the quality of services or as determined by the capacity to spend money is not necessarily influenced by the design you go for, but more by the choice of cash in the first place. Yeah, so this wasn't one of our indicators that we looked at because we believe that this is more looking at what's the value for money of cash assistance as determined by the appropriateness of the modality as opposed to the design of it. Our assumption was here we were looking at program where the use of cash was appropriate in the first place. And that's also linked a little bit to the question that Catherine has, right? In terms of the choice of context, so we have a bunch of criteria that we designed for being able to choose context in an as objective manner as possible. But one criteria was very pragmatic, was where are the contexts where humanitarian actors have decided to go beyond the business as usual type of model. And it happened to be that in contexts which are not Central Africa, organizations tend to be less risk adverse when it comes to how they organize themselves. So we've tried to be as wide as possible in terms of casting the net, hence including Colombia, so not to be only Middle East focused, for example, where it has been an incubator of innovation, but it resulted in, I agree, some contexts where it is like conducive of cash, hence conducive of innovation when it comes to operational model. In terms of the recommendation, so we had a heated debate about should we provide recommendation, like specific recommendation, and I guess the recommendation are the how-to notes, right? They are captured here, and the recommendation are more what are the key questions to ask oneself and when deciding for how to organize cash delivery. There are a couple of recommendations which are quite broad in terms of shifting the lens from demonstrating efficiency, because if you spend money to demonstrate that there is an economy of scale or efficiency of scale, that's not necessarily money well spent because this could be an assumption. So how do you demonstrate effectiveness, equity, and sustainability of your program? That's one. There is also a recommendation in terms of data sharing and being more coming forward in terms of sharing documents and sharing, because we know that there are a couple of studies that are out there that were hard to get, or that data wasn't necessarily comparable in terms of cost to transfer ratio, but how these were calculated was not accessible. So there is a recommendation in sharing those type of value for money related data. But in terms of the operationalization of the recommendation, I guess that's what we're going to discuss after the break, no? But there is no specific recommendation as to donors should do this or humanitarian organizations should do that. It's more pointing question that one should ask oneself when designing a program.
Wonderful. Thank you so much. So we're going to break for coffee now and reconvene at 11:30. Thank you, Hélène, so much for that, and to our brilliant panelists. Please feel free to follow Hélène out the room and ask all the questions you didn't have time to ask just now. And we'll see you and our facilitators for the next session at 11:30. If I could keep a couple of Calpies to do some room rearrangement, that would be great.